I was your boyfriend, never let you go. Keep you on my arm, girl. You never be alone. And I could be a gentleman, anything you want. If I was your boyfriend, never let you go.
This week on the Alex and Nathan Show, we're going to be talking about the reproductive system. The male reproductive system. First of all, the purpose of the organs in the male reproductive system is to perform the following functions. To produce, maintain, and transport sperm, the male reproductive cells, and protective fluid, semen. The penis. This is the male organ used in sexual intercourse. It has three parts: the root, which attaches to the wall of the abdomen, the body, or the shaft, and the glans, which is the cone-shaped part at the end of the penis. The glans are also called the head of the penis, and is covered with a loose layer of skin called the foreskin. This skin is sometimes removed in a procedure called circumcision. The opening of the urethra, the tube that transports semen and urine at the tip of the penis. The penis also contains a number of sensitive nerve endings. The body of the penis is cylindrical in shape and consists of three circular-shaped chambers. These chambers are made up of special, sponge-like tissue. This tissue contains thousands of large spaces that fill with blood when the man is sexually aroused. As the penis fills with blood, it becomes rigid and erect, which allows for the penetration during sexual intercourse. The skin of the penis is loose and elastic to accommodate changes in the penis size during erection. The scrotum. This is the loose pouch-like sac of skin that hangs behind and below the penis. It contains the testicles, also called the testes, as well as many nerves and blood vessels. The scrotum acts as a climate control system for the testes. Testicles or testes. These are oval organs about the size of large olives that lie in the scrotum, secured at either end by a structure called the spermatic cord. Most men have two testes. The testes are responsible for making testosterone, the primary sex hormone, and for generating sperm. Within the testes are coiled masses of tubes called the seminiferous tubules. These tubes are responsible for producing sperm cells. For normal sperm development, the testes must be at a temperature slightly cooler than its body temperature. Special muscles in the wall of the scrotum allow it to contract and relax, moving the testicles closer to the body for warmth or farther away from the body to cool the temperature. The epididymis. The epididymis is a long, coiled tube that rests on the back side of each testicle. It transports and stores sperms that are produced in the testes. It is also the job of the epididymis to bring the sperm to maturity, since the sperm that emerges from the testes is immature and incapable of fertilization. During sexual arousal, contractions force the sperm into the vas deferens. What is your problem?
Oh yeah, there, I have a big problem. I have a swelling on the side of the scrotum, and it feels like a bag of worms.
You have varicocele. Dilated and twisted veins on the testes, swelling on the side of the scrotum, and may feel like a bag of worms. Can be surgically corrected and may cause reduced sperm. Hello?
Hello, I have a slight problem. I have the opening of my penis is below the tip instead of at the tip.
Believe your condition is hypospadias, literally below this fleshy spike. A condition where the opening opens anywhere below the tip of the penis, rather than opening at the tip. Vas deferens. The vas deferens is a long muscular tube that travels from the epididymis to the pelvic cavity, to just behind the bladder. Vas deferens transports mature sperm to the urethra, the tube that carries urine or sperm to outside of the body in preparation for ejaculation. Ejaculatory ducts. These are formed by the fusion of the vas deferens and the seminal vesicles. The ejaculatory ducts empty into the urethra. Urethra. The urethra is the tube that carries urine from the bladder of the outside of the body. In males, it has an additional function of ejaculating semen. When the man reaches orgasm, when the penis is erect during sex, the flow of urine is blocked from the urethra, allowing only semen to be ejaculated at orgasm. Seminal vesicles. The seminal vesicles are sac-like pouches that attach to the vas deferens. Near the base of the bladder, the seminal vesicles produce a sugar-rich fluid that provides sperm with a source of energy to help them move. The fluid of the seminal vesicles makes up most of the volume of a man's ejaculatory fluid, or ejaculate. Prostate gland. The prostate gland is a walnut-sized structure that is located below the urinary bladder in front of the rectum. The prostate gland contributes additional fluid to the ejaculate. Prostate fluids also help to nourish the sperm. The urethra, which carries the ejaculate to be expelled during orgasm, runs through the center of the prostate gland. Ovorical glands, also called Cowper's glands, these are pea-sized structures located on the sides of the urethra, just below the prostate gland. These glands produce a clear, slippery fluid that empties directly into the urethra. This fluid serves to lubricate the urethra and to neutralize an acidity that may be present due to residual drops of urine in the urethra.
Male reproductive system today.